on Tobago updates. Now, I am being joined by two wonderful ladies, Miss Nickocy Phillips and Miss Carol Sawan Singh. And of course, Nickocy is the ambassador for TT Youth Will Rise, and Miss Sawan Singh is the director for Health and Social Programs Initiative. And we are speaking this morning about the distribution of health cards. Special good morning and welcome to you both.
Pleasant good morning to you, Candice. Pleasant good morning to Tobago.
Same here as well.
All right, so we're talking about some health cards this morning. So I'm going to get started with you, Miss Sawansing. Give us an idea about what are these health cards that we're talking about that we're distributing.
I think I'll start here. Sorry. Well, she is the director also of the Health and Social Initiative and also the CEO of Bismarck Technology and Learning Institution Limited. When this card was presented back in 2020, during the campaign, and we put aside politics. On Friday, I'll be having my prize giving distribution for Carnicopia, and also we wanted to launch the first wave of the cards that I would have promised in 2020. And this card is a health card that will be launched for most likely we in diabetic month, diabetes month. We took the initiative to start it this way, and especially to start in Tobago. So that is what we're going to be presenting on Friday. So we want you to come to tell the public as to what is happening, and we just give a little insight as to what the card is for now. We're going to give a lot of the information, but because Friday we want to launch everything, so we just give you a hint of what is happening on Friday.
Sure. Well, I know many of your viewers might be wanting to know what is this medical health card is about. Well, basically, it's a health card that will store your history, your medical history. And I know most people will think, oh, hearing the term of medical health card is for someone who probably living with a chronic illness, such as diabetes, or as well have a disability. But this card also is for anyone who is not living with a chronic illness. And why I say this is because I will explain further. Where that, for example, going to work, someone may break the stoplight and you get in an accident. You're rushed to the emergency department. All they have is your ID, your name. However, would they know your medical history? Would they know your blood type? Would they know what medication you are allergic to? And most of the time is no. So therefore, they have to run a series of tests, and every second counts in saving someone's life.
Yes.
So it's not just for people who are living with chronic illnesses or being disabled, but it strongly is recommended for each and everyone to have some form of identification of their medical history. And with this card, it is using the NFC technology, that is near field communication.
I see Nickocy has it. You could,
Yes.
up there. Can we see the actual card?
Sure.
Oh, the card.
Oh, that looks really sleek and nice. Yes.
So it used the NFC, the near field communication, just like how our bank cards and credit cards, you use a mechanism of this tapping. You use a phone that have the NFC settings. As well, it have a GPS locator, meaning that, for example, the first responders attending to you, they see the medical logo. Right. Come, let me demonstrate to you.
Yes.
Great. Right. So this is the card. This is the phone. What you do, you put on the phone here, right? The phone is on. There's my phone, right? Right. Good. Now what we're going to do, we're going to tap. As we tap, you see what happens?
Oh, yes.
So all your medical history, right, comes up. This is my portfolio, right? Everything comes up on the phone. You could keep on adding your medical history. Not only medical history, you could add a family member as well.
Yes, this is for the
Yes.
viewers.
Sure, right? You could add insurance. You could add your own platform onto this, meaning your own records, right? As I mentioned, I have a GPS locator. in the event that a first responder finds you and they use your card and they tap on it, it will send a locator to your next of kin or whoever you have as emergency contact. So therefore, he or she will be able to know where are your location. Because you know many times when emergency happens, and to get to their loved ones after,
Yes.
it might be a day after or a few hours after. So by having this type of technology, it will save you time and may save your life as well.
Now, I want to ask, is this being done in conjunction with the ministry or the Division of Health? You know, how would this work within our health system?
Well, last night we had a very brief meeting with the Health Secretary, Dr. Faith B. Israel, and we did a presentation for her to show her, because, you know, as I said to her, we have to put aside politics, and I'm always glad to always have her attention. We did that. She said after the presentation on Friday, we will have a dialogue as to how it will be welcomed into the healthcare system fully. We have also persons from outside other Caribbean countries. If this comes on board, and when it does come on board in Tobago, Tobago will be the first little Caribbean country or the first little island that has this kind, because the other Caribbean countries are already targeting us to actually have it done in their country. But we wanted Tobago to have the first preference. We wanted Tobago people to, you know, be that first wave of them demonstrating this kind, because we've seen just recently somebody fainted on the highway. They didn't know who it was and no identification. With this card, that is part of it. So, you know, this is an enhancement. As you see, COVID-19 has, you know, a lot of families, you had to be called to identify that person, and we need the upgrading technology. So we have that little meeting with her last night, Dr. Phoebe Israel, and she says after the presentation on Friday, we will have further discussion as to how we'll be able to welcome it fully in the healthcare system. So I can't say much because that was, you know, it was just a short, brief conversation we had on a
Okay.
presentation.
Sure.
Yes, I just want to say to the viewers out there, November is the month of diabetes awareness.
Yes.
I am a type 1 diabetic, diagnosed since at the age of 4. And in 2019, I was in Tobago. And I just recently met Miss Phillips through the Pan Theatre. And I went to I got a low blood sugar attack. She rushed me to the medical center. She didn't know what type of diabetic am I. Am I type 1 juvenile or type 2? She don't know my medication. She just said, okay, I'm a diabetic. So the doctors now have to figure out what medication I'm on and know exactly how to proceed.
And of course, you were not in a position to answer questions.
Correct.
Yeah.
So by having such a device like this, not only the cards we have bracelets as well. It will work excellent for loved ones, the seniors who are Alzheimer's, anyone.
They also have like bracelets. We know we have special needs kids who they sometimes wear helmet. They have a patch to put on it, so when you could tap the patch, you have the pouches to do it. We have different devices, but we're starting off first with the technology, because as I said, once the Secretary of Health or the Minister of Health comes on board, the technology will be enhanced. There will be new devices, but we just wanted to start with the cards first as the first wave of the technology being introduced into the Tobago space.
Now, who is behind this initiative?
I am. Actually, this technology was introduced many years ago in Trinidad. Actually, it was launched in 2010, but it was a different technology then. As you know, technology always advances.
Yes.
However, that government then did not embrace such device. Spoke about it, but didn't embrace about it. However, by using, it's everyone have a smartphone, so it'd be easy access to your health files. But how it works is that you alone will be in control of it with your password. No one will be able to change your medical on this card or bracelet except you give permission to your physician or whoever is the care providers. So you are in control of this. However, it's just the emergency department, the first responder will be able to see what medical history you have on this card.
And so this